Hello everyone, Dr. Van Merkel here. Great to be with you today. Got another couple interesting cases here going on. They have to do with cancer. One I've talked about many times when you see on your screen, the breast cancer case. And I've also got one on kidney cancer, and there's some similarities here that I wanted to discuss. Because this one on breast cancer, you see here, if you've heard me lecture, you've seen some of my materials, you've seen this case before where this lady, 48-year-old, diagnosed with metastatic breast cancer, clear back in 2007. It had metastasized already. Lymph nodes were positive. PET scan was positive. So it's already metastatic, clear back in 2007. If she does all the chemo and radiation they want, she was given 8 to 10 years to live. She didn't do any of that, followed our program. And that cancer marker was 185, you can see here, in 2 weeks dropped to 140. And by 3 months, it had dropped down to 22, which is way less than the clinical range. And she is gone for 12 years with that number being down in the low 20s. In the low 20s for 12 years. And she's perfectly healthy. Good deal. No problem. However, something interesting happened. This is real life. I mean, these are real patients and stuff happens. And this patient, on September 5th, 2018, we ran a cancer marker again, a CA2729, which, by the way, is the most common tumor marker for breast cancer in women, and it was 20.9. Great. And then we measured it again in March 23rd, and it had jumped 12 points to 32. That's alarming. It hasn't been that high for 12 years. It jumped 12 points in 6 months. That's huge. That's terrible. And so I talked to her, going to find out that in July 2018, a small aneurysm was found in the brain, and they would think was causing many seizures. So she started on these drugs, valsartan, CBD for the seizures, and lisinopril for hypertension, but she doesn't have hypertension. She is about 5'4" and about 110 pounds. She's very trim, thin, great shape. Never had high blood pressure. This lisinopril is more preventative to try and reduce the pressure to help lower the risk of the aneurysm getting bigger. And when it jumped up to 32, I asked her, when she came in and we talked, I said, okay, it jumped 12 points. Hadn't been this high in a long time. What are you doing different? Did you get off your diet? No. Is there any new environmental things that she's around? More chemicals or anything like that? No. And so I said, it's possible that these 3 drugs that you just started may be affecting your immune system such that your body is overloaded, taxed, and it's not able to keep the cancer under control. So maybe it's the drugs, the effect on your system, that's allowing the cancer to get out of control again. So here's what I told her. I said, what I recommend you do is go to your medical doctor and see if he'll modify the meds or reduce the meds. We don't want you having a stroke. We don't want the aneurysm getting bigger. We don't want you having seizures. So I said, but either way, but what we need to do is you check with your doctor, see what he'll do, and we'll check you again in a couple months. So May 11th comes, and you can see where it dropped down to 26.4. It dropped 6 points in a couple months. In 6 weeks, excellent, good job. So it dropped 6 points. At least it's not going up. It's coming down, big relief. So she comes in, I'm talking to her and said, okay, what'd the medical doctor say? Well, she hadn't gone back. She elected by herself to stop the meds because she was more worried about the cancer than the little mini seizures she may have been having. So she was more worried about the cancer than the seizures. And is it possible that small aneurysm was an incidental finding? Is it possible she's had that for 30 years? Quite possible. If she was willing to take a risk, I said, try it for a couple of months. And whatever you do, try it. But gotta make sure we get tested. And it's down to 26.4. Awesome. And so she's due to get retested again here in just a little bit. But this correlates with another case that I had recently. And let me see if I can find it. Here it is. 70-year-old female diagnosed in January of this year with metastatic kidney cancer. They found cancer in her lungs. Biopsy showed cancer in both lungs, only to find out that the biopsy revealed it was kidney cancer. Kidney cancer metastasized to the lungs, stage 4. As bad as it was, they gave her, it's 6 months to live. She elected to come see me and delay chemo or radiation so what we could do. Well, this is now August. From January to August, 8 months. She's fine. In fact, she's feeling, I think she looks better now than she did in January. She came in. She's feeling definitely better. But 70-year-old female, lung cancer, actually I should say renal cell carcinoma that has metastasized to the lungs. Now that is important that it's from the kidneys for these findings that we see. Okay. And we're going down to the report and, okay, apologize, it takes so long to scroll. Okay, first of all, the CA-125 is elevated, associated with the cancer, very high. Now, when we first saw her, let me see if I can speed this up a little bit. When we first saw her in February, it was at 19. Then it went up to 26. She's still kind of half-heartedly following the program. In May, still half-heartedly, it went up to 43. I said, okay, because now it's clinical. It's over 38. 38 is the clinical range for the CA-125. So it jumped, it went up, and now it went up to 43. Now I'm really getting on her to lower that number. So that was in May 21st. May 21st. And then we got May 21st is up to 48. And then we cracked the whip on her. And then a month later, we tested again, and it had dropped down to 37. Excellent. Great. And then we, she stayed on the same program. And then we tested her again in August, and look what happened. It went from 37 up to 107. 70 points. This is higher than it's ever been. This is extremely high. It should be less than 38. And the cancer is accelerating rapidly. This is not good. Very concerned. Now, some of the other factors of this case is you look up here, you see the red count is high, hemoglobin and hematocrit are high. That's common for renal cell carcinoma. Why, doctors? Why would that be? Why would red blood count, hemoglobin, hematocrit be a fairly common finding for renal cell carcinoma? Why? Because the kidneys produce erythropoietin. Erythropoietin, a chemical that stimulates your bone marrow to produce red blood cells. And so that because the cancer of the kidneys is high, all those cancer cells that are now producing too much erythropoietin, increasing the red count, hemoglobin, hematocrit. This increased red blood count is giving her high blood pressure. Got it? The erythropoietin is causing the red blood count to go up. It's making the blood sludgy. Too many red blood cells, it's sludgy. It doesn't move very well. And she's becoming not able to transport oxygen very well because too many red blood cells. So the medical doctor wants to put her on drugs to lower this down. I'm saying donate blood. You just get rid of a pint of blood. Well, she's Medicare, obviously. She doesn't want to pay the $60 to do it. And so I'm nagging her to pay your $50 and get your blood drawn and throw it away. She wants Medicare. So she finally got the medical doctor to order a blood draw, and they drew the blood, and look, things dropped nicely. She said, this was done just a few days before the blood draw, where they took a pint of blood and dumped it, was done just a few days before this test in August 8th. She said she almost immediately felt better. And I said, guess what? You need to donate more blood. Today is August 15th. I said, you need to donate another pint of blood now because it's too high. And I said, it is this that's causing high blood pressure. You need to dump the blood because you're high blood pressure. But the medical doctor, she said, wants to prescribe drugs instead. And so this patient went on, at this point in June, when they tested this, and this was high, The blood pressure has gone up. The medical doctor had her take 3 meds. Losartan at 50 milligrams, which is a pretty high dose. Metoprolol, 50 milligrams, and hydralazine at 75 milligrams. All 3 of those drugs in June. Look what happened after being on those drugs for just a few days, just a few weeks. Now, my personal opinion, I believe that these drugs' effect on her body is affecting her body's ability to fight cancer. The drugs are making the liver sick, and a sick liver reduces your immune system, and I believe that is why that cancer marker got so extremely high. So we're kind of a little conflict here. Actually, the nurse that drew the pint of blood and dumped it, she said, "Oh, this is common for renal cell carcinoma." She's surprised the medical doctor hasn't done it before, but he should be ordering it routinely, maybe every 2 weeks, some people every week. And so she's going back to try and get the medical doctor to run it because she thinks Medicare should pay for it because it's $50. I'm saying, I don't care. You need to pay for it yourself, because to keep your blood pressure down, because of renal cell carcinoma is causing your red blood count to go up, it's making your cancer worse. You see, I think you understand that thing there. And so really what she needs to do to get her cancer down, she needs to donate blood often enough that lowers her blood pressure so she doesn't need the blood pressure drugs, and then her body can get these numbers go back down. That's the problem. So I'm going to be talking, I'll give you an update here in a few weeks next time we have it, and let you know what she's doing. But we've got to change this. The meds, I believe, are causing problems. Today we have 2 cases this year where I believe the meds are directly responsible for increasing the cancer markers. Now, one, they came down nicely. I'm hoping to see the same thing on this. I'm Dr. Merkel. If you've got cancer, you got other health problems, and you'd like a natural approach to it, you'd like a second opinion, we at Science-Based Nutrition be happy to help you. I'm the inventor, developer of science-based nutrition. We have doctors that I've trained all over the country, and we can probably help you too with whatever your health problems is. Because sometimes even serious problems like this have simple, safe solutions. Donating blood. So give us a call, sciencebasednutrition.com, and we would love to try and help you with your health problems. I'm Dr. Merkel. Have a great day.